the government thought they could have achieved that end was first through a lockdown, so there's no interactions, or there's a lot fewer interactions across all classes of people, right? And then through aggressive testing and contact tracing with quarantines. I don't know if anybody here would have experienced quarantine, but a lot of it was very difficult on the people being quarantined and the people administrating the whole system. But in an effort to prevent the numbers from rising and toppling the system. This slide depicts something called the iceberg model. When you have a disease in a population, there's this stuff you could see, which is the tip of the iceberg, and there's all the stuff below the water that you cannot see. Our aggressiveness with testing determines the level of the water. The more aggressive you are with testing and contact tracing, the more of the iceberg you will see. The less aggressive you are, the less of it you will see. So I raise this because a lot of times when we're looking at the numbers, we're making comparisons without thinking about the iceberg. We are comparing one country to another country, and we are comparing one point in time to some other point in time. But if the aggressiveness with which the two populations you're comparing is not the same, the aggressiveness of testing, if one has a very laid-back approach to testing, or they don't have access to testing, they can't find the cases. If the other population testing left, right, and center, they'll find everybody, or a bigger piece of the iceberg. It doesn't necessarily mean that the two situations are any different. If you think about us in time, if we compare what we're doing with testing and contact tracing now to what we were doing in March 2020, there's a big difference. Yeah? So the number of cases that you're going to identify represents a very different piece of the iceberg in the two situations. When we start to think about, because what people do, I think, is they look at the numbers and they say, well, okay, I feel safe, or wow, this thing getting out of hand, I feel unsafe. And they guide their behavior with that. But bear in mind that what you're seeing is just the tip of an iceberg, and you don't really know what the water level is. So that number you're seeing might reflect a whole mountain of cases. So where are we now? Sorry. So what this table shows is numbers of deaths due to COVID, right? Assuming that we're all counting the same way, that what we report as a COVID death, we've been reporting it the same way all the time. And it shows the years 2020, 2021, and 2022 so far. Now, I show this to underscore a point. When we started the whole COVID journey as a country, we were matching levels of activity to our perception of the danger that the disease posed, right? So in 2020 KFC was closed, right? Imagine that. And you couldn't get doubles. Everything was, when doubles closed, everything closed. That was 2020. But look at the number of reported deaths in 2020. The country only registered 127 deaths from COVID in 2020. Now that is probably a result in part of severe lockdown measures that limited transmission and very aggressive contact tracing and testing. If you jump forward to 2021, we registered 2,723 deaths due to COVID. Now, I have worked it out as an average deaths per week for the period. So in 2020, we had on average, 3 deaths a week from COVID, 3.1. 2021, 52.4. Point I want to make is that in 2022, right now we walk around feeling pretty comfortable. But so far for the year, there have been a total of 1,040 reported deaths at 52 deaths per week. So 2022 so far, in terms of average numbers of deaths per week, is not that different from 2021. Sorry? Yeah. Now, this is the graph showing the daily number of deaths reported and the 7-day average. So the bars are the daily numbers. The 7-day average is depicted by the line. And this is from the last week in December coming into 2022, up to now. So you can see that the numbers of deaths have gone down. But if I were to show a similar graph for 2021, there were points in time in 2021 where we were closing up. I remember in March, just February, March 2021, I was working up at the green room helping with the testing. And I was telling one of the nurses, well, we seem to have nothing much to do except to test travelers. I think I'm going to go back to oncology because they have nothing going on here. I think we're done. Not more than a week later, the numbers started to climb. And we haven't returned to 0 cases on island since March 16th, 2021. But 2 weeks prior, I was planning to take some vacation and go back to my normal life. And that is maybe one of the stranger things about the pandemic. That when we think we know what's coming, we really don't know what's coming. It's anybody in December 2019 who said that they knew what 2020 would look like, lie. And anybody December 2020 who said they thought they knew what 2021 looked like was also talking inaccurately. So where are we going? Will there be more surges and deaths later in the year? If 2022, later on, we get something like 2021, something similar to Delta emerges, then the numbers for 2022 will make 2021 look like a joke. A lot of what we're doing is based on the notion that 2022 will continue this very gentle path. And this is why we talk about the disease is now endemic, meaning that it's always around. We'll get a few deaths here and there, but we're not going to get that kind of surge in deaths. So far, with Omicron, we're having a surge in cases, but thus far, thank God, not a surge in deaths. Yeah. The question is, what will future variants of the virus look like? How will they affect us? Are they going to be worse than Omicron in terms of their ability to cause illness? Or are they going to be like Omicron, but just transmit faster? And then the question of will the virus, the new variants, evade our immune responses? Will my vaccine and my booster still be effective protection? Would prior infection or infection with a previous strain be effective protection? Those questions are, to this point, unknown. And then the last question, will there be medium to long-term effects on our health from the virus? And there's another thing I think people miss a bit. We've so focused on the numbers of deaths, right? But death is not the only possible outcome or negative outcome from COVID. So, just itemizing 3 publications that speak to the question. One study identified more than 50 long-term effects of COVID-19. And this was what they call a meta-analysis, where they were pooling results from a number of published studies. Another one found that the risk and burdens of incident diabetes was higher after COVID. And in this second one, it was done in the US in their veterans health system. You know, Army veterans or armed service veterans have a special healthcare system in the States. So they looked at about 200,000 people who had been diagnosed with COVID and compared them to similar people who had not been diagnosed with COVID. And what they found was something like a 40% increased risk of developing diabetes. Now, Hopefully that's not going to be what it plays out like in real life. But imagine just a 10% increase in the rate at which people develop diabetes in Trinidad and Tobago. Health centers will be packed. We might need a next one again. We will end up with a lot more. And then if diabetes goes up, then high cholesterol goes up with it. Heart attacks and strokes follow soon after. Renal failure, dialysis, all these things cluster with diabetes. So the last study was published by the CDC. And when they looked at their data comparing kids who had COVID, people less than age 18, to those who didn't, they found an increased risk of diabetes among the people who had recovered from COVID. They didn't find it in under 12s, but in the 12 to 18 age group, it was a clear trend. And it was a trend that didn't have anything to do with how severe your COVID was. Even if you had mild disease, it still translated into increased risk. So, as we sit and we look forward, it's not just going to be about will COVID cause more deaths. We may also have a question of will COVID cause more lifestyle diseases going forward. So how has the pandemic affected lifestyle diseases? Effects on the economy. When people don't have money, when people are struggling, they eat not what they should eat, they eat what they can eat. Yeah? It's a very, very clear pattern. It's seen all over the world. People with lower income groups, ironically, have worse nutrition than people in higher income groups and have more obesity and diabetes, etc. Increased demands on healthcare resources. So if, for instance, long COVID becomes an issue, right? And let's say long COVID, for the sake of argument, affects 5% of people who were diagnosed who got COVID, right? Well, if everybody in Tobago got COVID, 5% of 60,000 will be 3,000 people who now need care for a long-term condition. That will then mean that we have to take resources from cancer or from anything that heart disease, all those clinics, and redirect it now to start clinics for managing long COVID. If, for instance, the diabetes problem that the studies suggest may happens, then it's going to pull on resources again. And then if you have more surges in cases, that also pulls on resources. Even the way we respond to it affects the system. Because, for instance, and Nurse Coffee would bear this out, in oncology, we are seeing more people coming through with advanced disease, later stage cancers. And when you take the history as to how come you now reach, basically. I was trying to get to clinic and the clinic was closed. I was trying to get an ultrasound and the department was down. I couldn't get this. I was scared to go in the hospital. All these things translate into time, and certainly for cancer, it translates into later diagnosis and worse outcomes. And that's a thing that happened for 2 years. So we might be reaping that consequence for the next 5 years. And then finally, the pandemic changed how people accessed care, partly due to economics, partly due to fear factor. A lot of people still do not want to go in the hospital because the hospital, you just get COVID when you go up there. Every time I try to refer somebody to the hospital, they give me a look. And I just have to give them this speech about, well, you wear your mask and you this and you try to wash your hands. But people have changed their health-seeking behaviors. People have changed their exercise. Even I, just looking at prior to COVID and prior to the pandemic and the lockdown and everything, I used to actually watch what I ate fairly regularly. But then when it looked like the world was coming to an end, thought to myself, I might as well have that cake. Because but those kind of things go through people's minds. You look at it and you're like, well, why make the effort, right? Why harass yourself? But we have to snap out it, right? Part of learning to live with this is learning to make our decisions in this new context, with all the uncertainties, with the appearance of the world coming to an end, and with all of those things, differences in other people's behaviors. We have to get it together and move forward. So, to conclude, what can we do about this? It's not enough to just tell people about a problem and don't suggest some kind of solution. Prevention is still better than cure. It's still better than cure. I don't know if I will die from COVID. I do not know if I will get COVID and end up with diabetes or some other health issue or long COVID. I don't know any of that. So it makes sense to try and avoid catching COVID. It makes sense to delay it, even if I delay it another 6 months by trying to wash my hands and adhere to protocols. It makes sense. It will pay off. Be mindful of your choices. When you come into an environment here, right, and everybody is distancing and everybody is masked up and everybody is conducting themselves in a way, or when you were walking in and everybody was washing their hands, you fall in line. You kind of look around you and you say, okay, this is the norm for where I am. This is what I will do. When you go into a place, you're in a carnival fete, or you're in a party, and everybody have a drink in their hand, so nobody's wearing a mask, well, you feel kind of stupid to have your mask on. And your behaviors are shaped by the environment that you put yourself in, the situation. Yeah? How you behave Sabbath morning in church is different from if you were down by a bar lineman. You may not, and when I say be mindful of your choices, you might not in the moment in a situation be able to pull yourself together and say, keep your mask on, wash your hands, and keep your distance. But you could choose which environments you go into. So my kids and I, we love to go and watch movies in Movie Town. We were very sad when Movie Town was closed. We wanted to go and see a new movie. We went Thursday evening. We were the only people in the cinema. Sorry, there were us and there were a family of 3, and there was us in the whole cinema, right? I don't feel unsafe making that decision. It would be very different from saying, boy, let me go Saturday afternoon, when you expect the crowds to be bigger. I remember one of the incidents where when we first opened up the place to everybody could get the vaccine, before we were doing it in a sequence or in an order. And then we said, look, we have plenty of vaccines. Let everybody who wants the vaccine and over 18 come and get the vaccine. And people descended on Shagona Health Center. And then the public blamed the minister for saying, come and get your vaccine. But if I'm a grown-up, or even a child, an intelligent child, goes and sees a crowd of people in a place, you're not going to go in the crowd. Be mindful of your choices. Your choices. But one of the big shifts that has happened is that COVID is not a government business anymore, where the government bossing things and saying, don't do this and don't do that. It's different. Now COVID is every individual's responsibility. Yeah? Everybody making a choice. And finally, we have to take care of each other. Things might get harder before they get easier. It will get worse before it gets better, right? The economy still has to recover. It's still fragile. And as that happens, people will still be at risk. People will still be vulnerable. So taking care of each other is about me not doing anything to transmit to you. It's about me staying home if I'm feeling sick. It's about me getting tested if I have symptoms. Yeah? And it is also about me trying to help another person who might need help. I might not have cash to give you, but I could give you a hand of banana. I might bring a breadfruit for you. And this is something about being your brother's keeper that has been one of the values from the beginning. Yeah, it's not news. And it's not a healthcare solution to a problem. It's a people solution. So we're going to need more community action. And by community, I don't mean like the village council. I mean like neighborhoods and people looking out for each other. And non-governmental organizations. Yeah? So the role of the church going forward will become even more important. Because as the formal healthcare systems start to get more strained, people are going to need something to fall back on to help take care of them. The Seventh-day Adventist Church has a very rich tradition of helping. Yes, ma'am, quite right. Very rich tradition. Yeah, it has been, even when I was a medical student, I remember myself and, well, he's now Dr. Baker. We were in class together. And MOVA S.D.A. was having a health outreach, which is a normal thing in the Seventh-day Adventist Church. And we went as students to take blood pressures and that kind of thing. Those kinds of things have to keep going. Yeah? The resources will come, but we have to keep it running. All right? Thank you very much for your attention. I don't know if I made it in time. I hope so. Thank you very much. Okay. Any questions? Yes, sir. After. Uh-huh. Mm-hmm. Right. Right.
Right. So for me, personally, I started to pay for my blood tests, and I'm not going to lie to you, it's very expensive. I had to get at least $3,000 to do for all my blood tests. And like I said, with the COVID, and when I came on stream, everything shut down. The money was not there. Yeah. When I had to divert in other areas. Right. Normally, I used to try to do my blood works every year.
Yeah.
But I missed the past 2 years because of the whole COVID situation and the funds. Right. So I was just wondering now, if, I don't know, maybe we could talk for TRH, if they have any intention of opening back the health promotion clinic to how it was before.
I can give you
to give you those.
But I can't talk for TRH.
Because it used to be the service was very good service. You get all the blood works. They had dietitians and they online working there also in terms of your health and food and things like that. But all that just scrapped now. So it's kind of, what to say? If you have the money, you have the money. If you don't have the money, well, crap or smoke your pipe.
I got you. What I would say, sir, so Health Promotion Clinic is a very special clinic, but the services that it offers in terms of screening, just doing your blood tests and that kind of thing, they're either available through the Blue Room, which is just up the hill from the Health Promotion Clinic for men, and they're also available at the health centers. What you have to do, call your health center and find out what day you could come in and get yourself checked out.
Okay, thanks.
Yeah, that is a thing that still, it was during the lockdowns and certain phases of the lockdowns, those services were restricted, you're quite right. But they've reopened for a while now. So the health centers are still up and running. Yeah. Yes, ma'am.
If a half bucket of mango is okay, it's okay for me to eat.
Okay.
Because that's what I do. A half bucket of mango every day, once mango in season. I want to know if it will kill me.
It's not going to kill you, but you need to share those mangoes. All right, well, there's a question for Pastor. I think Pastor will have to deal with you. But mangoes are good, and there's a good question, actually. Everything is good in moderation. Yeah? So people people, for instance, you see when you're managing diabetes, a person will come and tell you, I only eating whole wheat bread, but I'm eating a whole loaf of whole wheat bread. So it's better than if it was a whole loaf of white bread, and it's better if it was a whole bowl of sugary cereal. But even that whole wheat bread, if it's too much of it, your sugar will still be up. Because the calories, even though they're coming in more slowly, they still have to go somewhere. Yeah? So the half bucket of mangoes, no ma'am, I would not recommend a half bucket of mangoes. Not even a quarter bucket.
All day, active in the garden. I don't rest when the day comes. Does that calories burn out?
Okay, so I'll give you a good answer to that. From my personal life when I was more health conscious. So I would go to the gym and I'd be on the treadmill. And the treadmill will be giving you how many calories you're burning while you're exercising. The reality is, and it used to help me with my diet, I realized that if I drink a sweet drink, I can't run fast enough for long enough to burn off that soft drink. You would be amazed just how much exercise you have to do to get rid of excess calories. So at one point, at my best, I was close to doing a mile running in 6 minutes. But my calorie burn was only about 300 calories. So a half bucket of mango is a lot more than that. So the point about it, a lot of people think that exercise and activity will allow me to eat whatever I want. It don't work so. The better way to manage that calorie balance is to restrict your intake and stay active. Yeah? Yes, ma'am. Thanks for your question. That was awesome.
Doctor,
yes, ma'am.
We realize that the COVID has slowed down a little bit, but we're realizing now that monkeypox is on the rise.
Yeah.
How is that? Is that connected to the COVID, or what is causing that? What is it?
So far, to be honest, I really don't know. I was looking at an article this morning on it, because it's now starting. They found some cases in the U.S. as well. And they're now in the process of finding out if the case, I think it's in Texas or something. There's not Texas. Somewhere in the States, right? But they're finding out if he was linked to one of those outbreaks of monkeypox in Europe. Because it's now been in Portugal, Spain, different countries, UK as well, have recorded cases. So they're now sort of investigating to find out if there are links. One would expect that a case in Europe didn't jump from an animal reservoir to a person because they don't have the monkeys that are the natural reservoir for monkeypox. Yeah? So chances are there is human-to-human transmission. It is probably not related to COVID. Yeah? What they are concerned about, and I was reading another paper, there's been cases of children with hepatitis. And one of the theories they're working on is that having been infected with COVID and getting an adenovirus, which normally just causes diarrhea, predisposed them to getting this hepatitis that ended them up in hospital. And there's been like about 400 cases around the world so far. But as it unfolds, I guess WHO will give more information as they get it.
Because I heard they were saying that it is affecting persons of certain sexual and all that kind of thing.
I haven't seen any information like that. Okay. But it's certainly something I don't want people to leave here thinking that you must watch news every day to look for bad news. But it is something to keep, it's something going on, so you have to keep an eye on it. Yeah? Hopefully we don't show up. So for me as a clinician, for instance, if somebody came in with a rash like monkeypox into my office, I wouldn't have really thought monkeypox. It would be the furthest thing from my mind. Now that you're aware that, look, this is a thing happening in other parts of the world, now you would think about it. And that's what the doctors in the US had said, that they didn't think about it initially for the diagnosis, but then they took a step back and they said, let's test him for monkeypox, and it turned out he was the first case in the US. So we have to keep an eye on things. Yeah. All right. Okay. All right, well, I think that's it. So thank you very much for having me. It's been a real pleasure. Yeah.
So, Dr. Thompson, on behalf of the members of the Sandy River S.D.A. Church, we want to thank you for taking the time off to bring this presentation to us. And we really would put what we have learned into practice, because health is wealth, right? So we want to present this book to you. We understand that you love to read.
Thank you so much.
So we want to present this book to you and your family. Again, we want to say thank you.
Thank you so much. Thank you.
Okay. We want to thank Dr. Thompson, right? Good. We want to thank Dr. Thompson on behalf of the eldership and the church, the Sandy River Church, for the information that you would have given us. As you said, having the information will not always change our behavior, but we want at this time to make sure that the information that we have gotten, we would make some changes to make sure that our health remains optimum. Right, Sister Norma? Right. So that we want to be able to help others, and in helping others, we can easily spread the gospel so that others could understand, listen, health is wealth. Being sick, I remember this statement, if you want to know how much problems you could get, try sickness. If you keep trying the sickness, the amount of money you have to spend. So you know what? Let's choose to be healthy, and let's continue to praise God and do what He says. If we follow the health principles, we'll be okay. All right? We know we live in an upside crazy world, but in following the health principles, God will definitely help us to remain healthy so that we can do what we ought to do in helping others to see Jesus Christ. All right, so we have okay then, beautiful. All right, as we end now, let's stand so that we can pray. Thank you, Father, for this beautiful day. It was not too hot. At least we were inside the building, and we ask, dear Lord, that you continue to be with us. We thank the doctor for all the information that he would have given us, and we know all of it would have come from you initially. So continue to help us, dear Lord, to look to you and to focus on you, so that whatever we do, say, or think will be done always to glorify your name. Thank you again for keeping us alive, and continue to protect us, dear Lord, from the different diseases that we know that are ravaging our society and ravaging our earth. We know one day soon you will come and clean it up. Help us to be part that would enjoy the new earth. This we ask in Jesus' name. Amen and amen. Remain standing as we sing Shalom.
Shalom.
opportunity to thank my team, members of my team, Brother Ronnie, Sister Chris, Brother Garth, and myself for doing this program today. And thank you, church, for coming out and the support.
Good afternoon, everyone. Please be seated. Ladies, all the ladies of the Sand River S.D.A. Church, can we meet briefly to the front, please? Again, all ladies aged 16 and above, can I meet with you briefly to the front of the church, please? Thank you.